Hey viewers, hope so all of you are good, doing well, and this is the first video of the series Diuretics in the pharmacology subject. So here we go. We shall first of all discuss what is the diuretic, why it is called so, and then there are the therapeutic uses of the diuretics. And technically a diuretic is an agent that decreases sodium reabsorption from the kidney. Actually it reduces the sodium reabsorption from the kidney back into the blood, means that blood receives the sodium and increase urine, and it increase the urine. Actually there are some words that you should be familiar with. It is a natriuretic. Actually natriuretics increase the renal sodium excretion, and here is a sodium, and that Na involves means that it is a sodium representing term. And then we have aquaretic, that increase the excretion of solute free water. And for the following lecture I would like to introduce some terms that I shall use in the following lecture, that is the reabsorption. If the reabsorption word is used, it means that filtrate is moving into the blood, and if it is discussed that it is secretion, so the blood to filtrate movement happens, means that something is secreted. It means that it is going from blood into the filtrate. And here we have two terms, that is the luminal membrane or apical membrane. Actually it is and luminal membrane and the basolateral surface. And here's a sticky note. I shall show you that here we have this proximal convoluted tubule. This is the loop of Henle. This is the distal convoluted tubule, and here is the convoluted tubule, collecting tubule, sorry. So as the blood is moving through this, the blood facing filtrate is called luminal or apical membranal, and the filtrate that faces either blood or interstitium is called basolateral. Moving into the lecture. So diuretics, actually in 1937 carbonic anhydrase inhibitors were discovered. It is important that in 1937 carbonic anhydrase inhibitors discovered, and in the 1957 chlorothiazides were discovered, that are the most appropriate advancement in the diuretics synthesis. And here is some flow sheet, that renal corpuscles plus renal tubules. Renal corpuscles are used in this lecture, that involves a glomerulus, that is a tuft of the capillaries, and Bowman's capsule it is actually like a capsule shape, which gives the place to the glomerulus. Actually glomerulus is a tuft of the capillaries. And renal capsule plus renal tubules. Renal tubules are these one: renal corpuscle, glomerulus plus Bowman's capsule plus glomerulus. And next we have actually the proper definition is that diuretics are the agent that induce the state of increased urine volume by inhibiting renal ion transporter. And we shall read again that diuretics are the agents that make such a state in which the urine volume is increased. How do they do so? They actually inhibit the renal ion transporter, where they are present different side of the nephron. What they result? They result in the decreased reabsorption of the ions. It means that decreased filtrate to blood, means blood includes more ions and other electrolytes. And how they do so? Through renal ion transporters. And secondly we have the point that involves, because diuretics produce diuresis through its effect on renal sodium excretion, as this whole phenomena is affecting the sodium excretion, renal sodium excretion. It is also called as natriuretic, as discussed earlier. This sodium Na depict that it is a sodium excretion. And here is some tidbit that all natriuretics are diuretics, but all diuretics will be not natriuretics. Why? Because of the mannitol, exception of the mannitol, that is a osmotic diuretic. And here is the diuretic or natriuretic. What they do in the body, they change the body in the body pH, because the electrolytic balances are changing, and they change ionic composition between blood and urine. They change the ions composition between blood and urine. They increase the urine volume, and accept, as discussed earlier, that osmotic diuretics, for example mannitol, deals only with the movement of water. It does not involve the sodium reabsorption. And there are the therapeutic uses. Actually normal human body do urinate 1 to 2 liters per day. First is the renal disorders. We will face renal disorders, for example nephrotic or nephron, that is a functional unit of the kidney, will be destructed or syndromatic. In this nephrotic syndrome, foaming of the urine will occur, means that it will prompted to the protein and blood cells appear or color changes, and also edema occurs. Edema is actually a accumulation of the fluid within a body cell. So in the renal disorders, nephrotic syndrome, for example nephrotic syndrome, nephrons are destructed, foaming of the urine occurs, that will prompt it to the blood and blood cells in the urine, and the color changes resulting into the edema. And second one, we have cardiovascular disorders. Cardiovascular disorders involves two terms. First is a hypertension, means the blood pressure is increased. Second one is a congestive heart failure. These will be discussed separately. In the hypertension, PVR means peripheral vascular resistance will be increased, that will be leading to blood supply to organs reduction in the blood supply to organ is reduced. In the cardiovascular disorders, we have hypertension, congestive heart failure, and in the hypertension, discussing hypertension, peripheral vascular resistance will be increased, and that will lead to the decreased blood supply to the organs. And moving into the hypertension continued, that kidney do involves juxtamedullary cells. Actually these cells in the hypertension state release renin, that will secreting the angiotensin 2. Here angiotensin 2 is increased due to the release of the aldosterone. Heart deterioration will occur. Actually when the angiotensin 2 is increased, vasoconstriction is increased, means the blood vessels are constricted, and sodium and water secretions are also increased. And because the release of aldosterone is increased, it will be resulted in the heart deterioration, means the more workload on the heart, more blood pressure on the heart. So we have to remove that sodium and water and dilate the vessels, that will lead to the usage of the diuretics. So hypertension is included in the cardiovascular disorders. And secondly, we have cardiovascular disorder, we have congestive heart failure, that is also called as right heart failure or left heart failure. Actually it do involves two subcategories. Actually, in congestive heart failure, backward accumulation, that is also called as congestion, occurs. Blood do accumulate backward and congestion occurs. Right heart failure, RHS represents the right heart failure, LHF represents the left heart failure. As the right heart includes the deoxygenated blood, so body organs push the blood into the lungs for oxygenation. But when this doesn't happen, this facing the abnormality, liver will be enlarged and there will be the accumulation of water in the abdomen that will lead to edema states, and then the hand and feet edema will occur. While moving into the left hand side, deoxygenated blood involves into the left heart failure, and as the lungs provide blood into the body organs and this doesn't happen, this is abnormality. So pulmonary means lungs. Pulmonary edema will happen, that is a lethargic state. As in the congestive heart failure, there is a right heart failure, left heart failure. Backward accumulation called congestion. Deoxygenated blood cannot go to the lungs for oxygenation, so liver enlargement will occur, hand and feet edema will occur, abdomen will be flushed with the water. So in the left heart failure, there is a lungs that will not providing blood to the body organs, so pulmonary edema will occur, blood will accumulate in the lungs. And moving into the next state, we have edematous state. Actually, this is the state in which we use mostly diuretics. We have to use diuretics. This is a compulsory state. It involves heart failure, edema confirmed, as discussed earlier that in heart failure edema will be happen either in the liver, either in the pulmonary edema will occur. So hepatic cirrhosis state involves a chronic liver syndrome in which hepatic portal circulation occur, result in increased blood volume. As the blood volume is increased, we have to use the diuresis. But here question arises, why we use diuresis? Because it also involves the increasing of the blood. So I will discuss later on in the next point. Abdominal ascites will occur. Accumulation of the water in the abdominal will occur, and then we involves the secondary hyperaldosteronism, means aldosterone, that is the steroidal hormone, is increased. As on the fourth point, we have endocrine disorders that involves the diabetes insipidus. Insipidus involves the polyuria, means there is a large amount of dilute urine. As there is a dilute urine, we have to use diuresis. But why we have to do so? That diuresis also includes the increase in the blood urine in the body. So we will use diuretics because we have to eliminate that dilute urine, and we have to make a normal urine, not a dilute urine. So we'll use diuretics that will excrete sodium, and it will also thickens the urine. And it also involves polydipsia, that involves a abnormal thirst. And in that state we shall use specific thiazides. And moving into the fifth and last point, we have hypercalcemia. As the calcium increased, because it is also an electronic imbalance, due to which the change in the body pH will also occur, and change in the ionic composition between blood and urine will also occur. So we shall use loop diuretics, especially for the removal of calcium. So I shall give you a quick overlook that diuretic is an agent that reduce sodium reabsorption and increase urine. Natriuretics involves sodium, aquauretics involves the water excretion. Reabsorption means filtrate into the blood. Secretion means blood into the filtrate. Filtrate means the urine that is forming. Diuretics involves 1937 carbonic anhydrase inhibitors, 1957 chlorothiazide discovered. And then we have the diuretics definition and then the therapeutic uses, and here is the diagram. Thank you. Peace out. Meet you in the next part of the diuretics.